everyone, my name is Nicole. Today I'm going to be doing massage for the lower back. Our model for today is the lovely Ashley. Alright, let's get started. Alright, today we're going to be working on the lower back, so I'm going to start with a little bit of oil. Just like to place my hands on the client gently so that we can both become in a calm space. I'm just going to make some figure eights with my hands side by side. I'm not putting too much pressure at this point, just kind of trying to spread the oil around and introduce my touch to the client. Then I like to do this pulling, coming towards the spine. But I'm not going to cross the spine with any pressure. Making intentional contact. This can be a kind of sensitive, ticklish area for clients. So if you make contact with good intention, move slowly, we can tend to bypass that tickle response. Then I might do a little bit of ringing here. Just trying to warm up all of the tissues in the lower back. Next, I'm going to make some superficial circles. Superficial because I'm kind of just gliding across the skin here. I'm not pushing in too deeply. Just again trying to introduce some warmth and fluidity to the tissue. I'm going a little bit below the ilium here into the top of the glutes. Our glutes do play a large role in our lower back, so I never leave them out when I'm doing a lower back protocol. Then I might stack my hands and make smaller circles. And we can make these circles on the sacrum too. That feels really awesome. And these smaller circles are going to be a little bit deeper, more intentional, really focusing on these erectors here. I might make my way back down. And since we did some deep work, I'm just going to come back in with some like circular effleurages here. Give the body a moment to adjust to that pressure. And now I'm going to come to the other side. So those are the things I like to do across the table. Here are some things that I like to do on the same side of the table. So here, I'm kind of making little circles with my whole hand. It's in the motion of a petrissage, but we can't really lift these erector muscles off of the bone per se, so it gets kind of a different feel than normal petrissage. And I'm going to do the big superficial circles. So I like to do these across the body or on the same side of the body. It doesn't really matter. If you have shorter arms, it might matter to you though, I guess. And making sure to get some superficial circles on the upper part of the glutes here. And then I'm going to come into some deeper circles. I'm going to start on that sacrum. Don't want to go too deep, but we definitely want to go a little bit deeper, smaller intentional circles. Making my way up the erectors. I'm not running into the spine. I'm not doing these deep circles over the spine. And circles back down again. And some deeper circles into the upper glutes. Might move a little bit slower here. There's a lot more tissue here to work through. And some circular effleurage to allow the body to integrate that depth that we just reached. Next, I like to introduce the QL along with the upper gluteals. Just making 2 fists side by side, coming down towards the table, and I'm going to be really careful to not pinch the client against the table here. Disengage. Do that again. The nice broad strokes of my fists allow me to reach about a medium depth. And a third pass. Then I might want to get a little more specific. So I might feel for the top of the ilium, and I might feel for the bottom of the rib cage. So I can fit about 2 of my knuckles here. So I'm going to start right on the side of the spine, not on top of it. And I'm going to move very, very slowly through this tissue, passing over the erectors, now moving into more of the QL and lats tissue. Since we're going deeper and more specific, I really want to move slowly as the tissue allows me to disengage. I can introduce this into the upper gluteals as well, but I'm going to start right off the edge of the sacrum with this left hand here. And again, moving slowly through the tissue. If I feel an area with a lot of tension, I might just pause for a moment, allowing that tissue to melt. I never want to force my way through any really dense tissue, and I might even need to back off on my pressure. And one last time. This time I'm going a little bit deeper, so I'm going to move even slower. Kind of working through all the different layers. And some effleurage to integrate. I'm going to want to work a little bit deeper on the erectors here, so I'm going to stack my fingers. And I'm kind of in that lamina groove that's right beside the spine. And I'm going pretty deep, so again, I'm moving very slowly. And today we're focusing on the lower back, so you could really do this all the way up the entire back if you wanted to, but I'm gonna go just a few ribs. And once I finish this pass, I'll do a nice effleurage to integrate the depth. So that was right next to the spine, the lamina groove. Now I'm going to move over a little bit. So we're trying to cover the entire area of the erectors here. Again, we're going pretty deep, stripping the erectors here, so you want to move as slowly as the body instructs you to. You might even need to hold and pause and melt if there's a lot of tension. Again, integrating with some nice effleurage. And I'm going to move out a little more laterally. Depending on the body structure of your client, you might need to do more or less passes. I think 3 is going to catch the bulk of the erectors here for us today. And finishing with effleurage. So now I'm going to think about that QL. The QL has fibers moving in multiple directions. So the up and down direction, which we just did, and there's one coming from the ilium up to the spine, and then from the ribs to the spine. So if I felt a lot of tension in this area, I might go back and do it again. So especially in that laminar groove area, there was more tension. So I'm going to go back and do that just one more time to try to get a little bit deeper in that area. And finish with an effleurage. Alright, so beginning just above the sacrum, I'm going to make one little pass towards the spine, following that QL muscle. Again, I'm going to move out laterally, and then I'm going to aim a little bit higher on the spine, moving slowly through that tissue. And I'm going to do a third pass even more laterally, and then a little bit higher. And I'm trying to stay under those last ribs. So depending on how much space your client has between the ilium and their final ribs will determine how many passes you can do. And then from the ribs, we're going to go down, trying to reach where the sacrum and the spine meet for this first one. Then I'm going to move a little more medial and aim a little bit higher on the spine. Again, moving through the tissue as it allows me to, not rushing it. I feel the spine, so I disengage. And then my final pass is going to be very small, but intentional. And I might integrate with some effleurage here. Maybe some more petrissage. Giving the body a moment to integrate. That was a lot of deep work. We'll allow our clients to have a breath per se. When we're thinking of lower back, we can also think of the lats, which come all the way up and attach at the humerus. But for today, I'm just going to work on the lower part and not the upper part attachment. Next, I'm going to move on to the glutes. So we've already warmed it up a little bit, but it's been a minute, so I am going to come back in with these fists that follow one another here. Loosen up the attachments at the upper part of the glutes. And then I'm going to move into the more medial portion of the glutes. Get a little bit more oil. And I might ask my client, do you mind if I move your swimsuit? Okay, I'm going to just move it up a little bit. I'm going to try to aim to be above the ilium here. That way I can access more of this space. If your client is wearing something that allows you to access the entire glute, it's great to be able to get some oil on here to really warm up. If they're wearing full underwear, don't feel comfortable taking it off, that's okay too. There's a lot of things that we can do through people's clothing. Tune back in, I'll definitely do an episode on that. So here I'm just doing some nice effleurage and a circular motion, kind of aiming for that trochanter to be the center point of my circle here. So here's one of the things you can do if they end up wearing something and are covered. We can do these nice circles. So I kind of glide really well because I have the oil on today. Of course, if your client had fabric here, the twisting motion might not, happen have as much rotational turn here, but just pushing into that tissue with intention at a slow pace so that the tissues can adjust under our pressure. Then I want to make sure to get more of these lateral muscles here as well. We have the glute minimus and medius around here, as well as the TFL. All right. Might do a little bit of petrissage. And then next I'm going to do more of our circles. So starting with the superficial circles, gliding across the skin, not pushing in too deep. And the direction of the circle is important here. I am moving medially and superiorly with my circles. I feel that this direction is a little more comfortable for clients when we're working on the glutes, which can tend to be a sensitive area which might hold trauma. And then we might want to go a little bit deeper with our circles. I stack my hands, and I'm going to go into the muscle tissue. Now when I'm doing this part, I am kind of doing a little bit of sonar, and I'm trying to discover where the tension might be lying so that I can come back in a moment and do some nice melting. I'm just tracing around any bony landmarks here. I don't really want to push into or go over the bony landmarks. I am going to find where that sacrum lies, and I'm just going to do a little cross fibering. Back to deeper circles, moving more slowly. So here I can feel that piriformis is a little bit tight, so I might want to come back and focus on that. All right, so I'm going to do a little bit deeper work here. I'm going to come in with my forearm, and I'm just going to rest for a second. Just allowing the body to adjust to this deeper, broad pressure. And then I'm going to move. And I'm aiming for like halfway down that lateral hamstring. Using my forearm to create the pressure so it's nice and broad. And I'm moving through the tissue as it allows me. I don't want to go in too deep or too fast and have the muscles just tense up. Disengage. I'm going to come back and I'm going to move a little bit more medially. I'm kind of going to place my arm so my elbow's like right dead center of the glute, making sure that you're not pushing into the sacrum or any bony landmarks. And I'm just going to hold it here for a little bit, melting, and then I'm aiming for the middle part of that lateral hamstring as I move. And I'm trying not to push into the ischial tuberosity, that sits bone. Just trying to glide on the tissue on top of it. And disengage. So again, I noticed that the TFL was kind of tight, so I might go back in to where the TFL comes out of the sacrum here. Do a little bit extra of that kind of scrubbing work along the side of the sacrum into the tissues of the muscle. I can also do my 2-finger method where I'm kind of stripping that muscle. So I'm going to find where that trochanter is, and I'm just going to move along the muscle here. Again, I'm going really deep, so I want to go really slow as well. This can feel really intense for our clients, so we want to be watching their body for any cues, or we can always check in with them about the pressure when we're doing deep work, right? And then I want to integrate with a little more of this circular effleurage. And I might come back to the lower back just to show some integration. Remind the body how the glutes are connected to the lower back. Then I'll thank my client. Thank you, Ashley. Thank you so much for watching, and be sure to check out the next video in the series. If you enjoyed practicing with me today, please check out our Patreon, where you can find exclusive videos. See you soon.